Hello, my name is Karen Grubbs, and I'm a student at Regis College, and I've written a paper on chronic pain management and the efficacy of pain medication. The title of the paper is Chronic Pain Management and Narcotic Pain Medication Efficacy for Long-Term Use, and it is a literature review. So one important thing to note before we go on to any further slides is that there was very scant information on chronic pain management with opioid medications. There were only 2 studies available, and this made the research very difficult and laborious. However, I was able to find 2 studies, and I will go over those here in just a moment. Okay, I'm going to go ahead and click to the next slide. Hopefully I can do this right. Hold on. Oh. Okay, so the problem statement. Chronic pain is a problem for many patients following traumatic accidents or illness. Patients' lives are often altered with few solutions on how to cope with chronic pain and disability. The purpose of this review is to determine if narcotic pain medications are effective in treating chronic pain lasting greater than 3 months and increasing activities of daily living. So while I was doing the research, I was able to find lots and lots of articles regarding pain management with narcotic pain medications for pain lasting less than 3 months. So the pain would last about a week or so, and that is not the purpose of this study. So I could not use any of those references. However, as we will see here, I did find those 2 studies that were, one of them was very high quality and the other was very poor quality. Background. Okay, so according to the U.S. Department of Health and Human Services, chronic pain is the most common cause of long-term disability. This is staggering considering chronic pain is undertreated in our society today. In the news, we see a lot of things about people dying from overdoses of narcotic medications and, them being sold on the streets and stuff like that, and how dangerous they are. Of course, all these things are true. However, I do believe that there is some validity to, or there is a purpose for narcotic pain medications when used correctly. So there are currently 25.3 million Americans that report experiencing daily pain, and 14.4 million Americans report experiencing extreme pain. And that's also according to the United States Department of Health and Human Services. Back pain is a leading cause of disability in Americans under 45 years old. More than 26 million Americans between the ages of 20 to 64 experience frequent back pain. So quite obviously, pain is a major health issue, especially chronic pain, and it needs to be addressed. If narcotic medications are ineffective or not an option, then there are, of course, other medications that can be used and actually should be the first line. So some of those medications are non-steroidal anti-inflammatory drugs, skeletal muscle relaxants, antidepressants, benzodiazepines, and systemic corticosteroids and anti-seizure medications. So if all of those medications have been tried and they're ineffective, or they cause the side effects are too harsh, then opioid therapy should be a consideration. Obviously, this isn't going to be something that is effective for everyone, but it can help some people. Okay, so the nursing domains. So the implications for research include increasing awareness of chronic pain as a major condition and improving effective pain management for chronic pain patients. Further studies need to be done on chronic pain and effective pain management. So, like I said before, there were barely any studies on chronic pain and narcotic pain medication efficacy. And I think that more studies need to be done. There are plenty of people on narcotic pain medications, and so the studies should not be that difficult to perform. Education. The nursing profession needs to be aware of effective chronic pain management and how to effectively treat chronic pain patients. Chronic pain patients currently frequent ERs actually quite a bit. I mean, some of them are drug seekers, of course, and others are actually experiencing chronic pain. So patients with chronic pain should be believed about their pain. I know this can be difficult when there are people who are dishonest about it, but it really hurts the people who honestly are struggling with chronic pain. Drug seeking should be a consideration, but should not delay treatment, and I firmly believe that. Of course, we do not want to exacerbate anyone's drug problem, but at the same time, people deserve to be believed. Practice. CDC guidelines are important tools for managing chronic pain. APS guidelines are actually also very important. Narcotic pain medications should not be prescribed unless a patient has failed all other modalities. And we spoke about some of those modalities earlier. This includes PT, OT, surgery, injections, non-opioid prescriptions, and many others. All avenues should be exhausted before pain medications are considered for long-term use. And this is definitely true. We don't want to jump the gun, so to speak, and move right into opioid therapy just because somebody says that they're hurting. You know, let's try something a little bit less extreme first. Okay, so the purpose of this review was to determine if narcotic pain medication is effective in treating chronic pain lasting greater than 3 months and increasing activities of daily living. So increasing activities of daily living is very important. A lot of people with chronic pain do have issues completing their activities of daily living, such as housework, cooking, maybe taking care of the children, taking care of the dogs, doing basic stuff that someone who doesn't experience chronic pain, would, be able to do. So it's very important to understand that that pain medication is not just treating the pain, it's also helping to increase the activities of daily living. So the investigative questions are as follows. Are narcotic pain medications effective in treating chronic pain lasting greater than 3 months? Are narcotic pain medications safe for long-term use? Does narcotic pain medication improve quality of life for chronic pain sufferers? Okay, I'm going to move on to the next slide. Okay, so this section is a review of the literature. So this is about basically the 2 studies that I found that actually talk about chronic pain and opioid therapy. So the first study is a Taiwanese cross-sectional study of 210 people in a registered pain clinic. And they completed surveys regarding pain intensity, functionality, and aberrant behavior. Overall mean pain reduction was 49.6%. Functional interference was reduced from a mean score of 7.7 to 4.2. So quite obviously, 49.6% is definitely statistically significant, and that should not be ignored. The qualitative case study, which was the second study that was involved in this review, was a case study of 11 chronic non-cancer pain patients. And this study found that 50% or greater relief in pain intensity. So this study was very flawed. It was a case study report without any quotes from the participants in the study. It was just basic information, and it did not describe where they got the information from. The reason that this study is relevant is, 1, because it was one of the only other studies that I could find, and 2, because the results were congruent with the first study. So lack of current studies on chronic pain management with opioid prescriptions could be detrimental to the chronic pain community. Obtaining current, accurate research may help thousands of patients in their search to find relief. Okay. And these are just the references here. Conclusion. Opioid medications may be effective in treating chronic pain with proper monitoring. CDC guidelines should be used to safely and effectively monitor opioid use. There are not currently enough studies on chronic pain management with opioids, and therefore leaves current research unsupported. Serious flaws exist in current research. So based on this conclusion, we need to do more studies. Not only do we need to do more studies on opioid medications in chronic pain, but we also need to try to find maybe some better ways to help alleviate that pain. Maybe some ways with medications that aren't addictive, or some treatments. A lot of research needs to be done, especially considering it affects so many Americans. So this is the conclusion of my study. Thank you very much, and yes, I hope you learned something.